Hi guys, it's Dr. Sammy Pryor, and today my video is not on a topic I'd like to talk about, but it's on uterine cancer is on the rise, especially in black women. So guys, if you are guys subscribed, you might want to watch it because you can warn any women in your life if you hear these symptoms. But what sparked me to make this video was that I got an email about this in my inbox, and it sparked my memory of Gwen Eiffel. I loved her. She was a moderator for the PBS NewsHour, or newscaster, and a moderator for many debates. And I loved her, and she came on the air. I watched that show pretty regularly, and she came on the air and said, "I'm stepping down from the show. I have been diagnosed with cancer, and I've been battling it." And it was very shortly after that she passed away with cancer. So, cancer of the uterus is called endometrial cancer, and it's increasing so fast that they believe it's going to displace the colorectal cancers by 2040. And it's the third most common cancer among women, and it's the fourth leading cause of cancer deaths in women. And the mortality rates have been increasing by almost 2% a year overall, with sharper inclines in women of Black, Hispanic, and Asian descent. Okay, and that was found in a study in the JAMA Oncology. Okay. And if this disease is detected early, there's high survival rates, so you need to be aware of the symptoms, which is any changes to your menstruation, bleeding, and that can be in women that are still of childbearing age, perimenopausal women, any changes in your bleeding, and then really you're much more increased to have cancer in your older age. So any women that are postmenopausal that have any kind of spotting or bleeding, that is a huge warning sign. You can also have uterine pain. You can have pain on urination or intercourse. You can have bloating. That's more common in ovarian cancer, but still a common occurrence. Weight loss, fever, and fatigue. These is universal for cancer. If you're having those, then you need to be checked out for any kind of cancer. But that's yeah. So back to the death. Black women are twice as likely to die of uterine cancer compared to white women, which makes this one of the largest disparities in the cancer deaths. And black women are more likely to be diagnosed with aggressive non-endometrioid cancer, uterine cancer. So that's why they possibly, but also the lack of proper care. And black women represent just under 10% of the 208,587 uterine cancers diagnosed in the U.S. between 2000 and 2017, but they made up 18% of the nearly 16,797 uterine cancer deaths during that period. Yeah, and basically the women of Black and Hispanic descent are less likely to have surgical removal of the uterus, called a hysterectomy, and less likely to have the surrounding lymph nodes biopsied, and less likely to have chemotherapy. An expert panel of the American College of Gynecology and Obstetrics found. Okay, and also the ultrasound scan that detects the endometrial lining, that looking for the thickening, it is less accurate when there's fibroids, and black women also are more common to have fibroids. And basically, if you are a woman, you really need to have your hormones checked if you're having very heavy bleeding, because it is very common nowadays to have an estrogen dominant picture, and that really predisposes you not only to uterine cancer but also breast cancer and even ovarian cancer. So if you have never been to a naturopath to get that ratio checked, that's very important. Another thing is there's two metabolites of estrogens. One's called 2-OH estrone, and then there's the 16-OH estrone. The 2's protective and it blocks high estrogen activities and it doesn't promote cell growth, but the 16-OH does, and that is much more carcinogenic, and it can also predispose you to autoimmune conditions. That's why autoimmunity is much more common in women. And we know too much estrogen exposure altogether does promote your likelihood of having uterine cancer. So, you know, there's things you can do to lower your estrogen burden, and I am accepting patients. You can reach out, we can run hormones, we can look at these things, but it's prevention, guys. You don't want to get cancer, okay? And so if you catch it early, you do things, you implement things, it's much better. Okay, guys, so please spread the word. It's on the rise for all women, but especially black women. So please share this with any woman you know, and let's get the word out, guys. I love you, and I promise I'm going to make all sorts of health topics, so please subscribe so that you won't miss any topics. And if you could give me a thumbs up, I would appreciate it. Okay, bye. Have a good rest of your day. Bye.